Hey everybody. My name is Tony McNeil. I am a lead community organizer with Faith in the Valley, and today we are going to be having a conversation with our guest from the San Joaquin County Health Services in order to make sure that we have some updates, the real time updates regarding to COVID and some of the resources that are available, and just how to use them, different CDC guidelines that are ever changing and ever before us. So what I want to do very quickly, we're diving in. We know it's the lunch hour, and so I'm only stalling for a few minutes just to give different people time to tap in from their different spaces. While we're doing that and allowing folks time to tap in, we're going to go around and just have a round of introductions. And so I'm going to start with you, Chris. Can you introduce yourself?
Thank you. Yeah, my name is Chris Cannon. I'm the program manager at Public Health Advocates with the REACH COVID and Flu Grant.
And Chris, who are you going to pass it to?
Yeah, I'll pass it to Mary.
Thank you, Chris. I'm Mary Davis, and I'm the outreach specialist for the REACH COVID Flu Grant with Public Health Advocates. And I am going to pass it to Alex.
Hi everyone, my name is Alex. I work with San Joaquin County Public Health Services and I'm a public health educator.
Good afternoon, everyone. My name is Daniel Kim. I'm a I'm a health promotions program coordinator for the health promotions unit here at San Joaquin County Public Health Services.
So today you all, and once again, my name is Tony McNeil. I'm the lead community organizer for the San Joaquin County here with Faith in the Valley. And so we do these live COVID conversations. We do twice a month. It's a partnership that we have established between Faith in the Valley and the REACH branch of Public Health Advocates, in order to just address some of the real issues that are taking place in the hard to reach communities. Some of the concerns or feelings and myths, sometimes we address those. And so it's just always a diverse conversation. This go round, what we wanted to do was we wanted to pull in some of our leading community experts in order to answer some questions and dispel some myths in regard to what's going on with COVID, provide some information and updates in order for us to just be able to really practically know what's going on and make informed choices and decisions. We're going to be sharing some information. Alex is going to share some information for us today, and we'll be doing just some presentations through some slides. What I want to also make sure that those that are tuned in know is that if you have questions that come up, that you are able to actually drop them in your chat, that I'm able to see them, and we can react and respond to those in real time. So please use your chat. Use your comments, however you see fit, in order to put your questions in there. And I'm also asking that for those of you that tap in, share this on your page. Share it like now. Go ahead and share it on your social media platform. Share it on your page, just so that you know we're also streaming from YouTube. Let me get that link for you. So for individuals that are unable to tap into Facebook, and they can actually watch this right now being live streamed from our YouTube platform as well. And so I'm dropping that in the chat now. And you can share that in a text message. This is real important information. It's real time and it's very relevant. So with all of that being said, Alex, I want to go ahead and kick it over to you in order for you to just get us started.
Well, thank you so much, Tony, for that introduction, and thank you for having us today. We're excited and honored to be here, so we'll get started. Next slide. So we're going to talk about and provide an update with the current county data. And if you might just advance, Tony, thank you. All right, so this data is from sjready.org, our website, on our COVID-19 weekly report, and was updated on January 19th. The total number of cases in our county are 135,983. Since the previous report, there have been more than 15,000 new cases in our county. The total number of deaths in our county is 1,957. And I do just want to point out that in all of our data, there is a slight delay. Next slide, please, Tony. So this data was collected from the California Department of Public Health website on January 20th, and it's specific to San Joaquin County. Our current case rate in the county is 248.8 per 100,000, and our test positivity rate is 29.3%. As you can see, in the last few weeks, our case rate and our test positivity rate have increased quickly and significantly. Next slide, please. This data was also collected from California Department of Public Health website on January 20th and is specific to our county. We currently have more than 420,000 fully vaccinated people in our county, as well as more than 153,000 partially vaccinated people. We have 294 COVID-19 positive patients in our hospitals, and 61 of those are in the ICU. Next slide, please. So the bar length represents the weighted size of the population by age group. The dark blue part of the bar represents those that are fully vaccinated in that age group. We are really encouraging people, especially our school-aged residents, to get their primary series completed. Additionally, boosters should be completed by all that are eligible. Next slide, please. So now we're going to go over the current quarantine and isolation guidance. This quarantine guidance was updated at the beginning of January. Quarantine happens when someone is exposed to a suspected or confirmed case of COVID-19. For general guidance, if you are unvaccinated or you're vaccinated and booster eligible but have not yet received your booster dose, you should stay home for at least 5 days since your last contact with the person who had COVID-19. Test on day 5. And if you do test negative for COVID on day 5 and are not experiencing symptoms, your quarantine can end after day 5. Please make sure that you're wearing a fitted mask around others for a full 10 days following an exposure. Special workplace quarantine guidance was revised, stating that if you are fully vaccinated and booster eligible but have not yet received your booster and were exposed to COVID-19, you are not required to stay home if you test negative within 3 to 5 days from your last exposure. Please make sure that you're wearing a mask around others for 10 days and continue to not have symptoms. Next slide, please. If you are boosted or vaccinated but not eligible for a booster yet, you are not required to quarantine if you are exposed to someone with COVID-19. You should test on day 5 and continue to wear a fitted mask around others for 10 days. If you test positive, you should follow the isolation recommendations. We'll cover that on the next slide. If you do develop symptoms, please test and stay home. Next slide, please. So isolation should occur when you test positive for COVID-19. Regardless of your vaccination status, booster status, previous infection, or lack of symptoms, you should stay home for 5 days. Isolation can end after day 5 if symptoms are not present and resolving, not present or resolving, and you collect a negative COVID test on day 5 or later. If someone chooses not to test, then their isolation can end after day 10. If a fever is present, you need to wait until your fever is resolved to cease isolation. If other symptoms are not resolving, isolation can end after day 10. Again, please continue to wear a fitted mask around others for 10 days. Next slide, please. Thank you. We're going to cover some of the COVID-19 therapeutics. All right, so let's talk about monoclonal antibody treatments. These are available through San Joaquin County clinics and at San Joaquin General Hospital, as well as other participating hospitals in the county, including Adventist Health Lodi Memorial, Kaiser Hospital Manteca, Kaiser Stockton Clinic, St. Joseph's Medical Center, and Sutter Tracy Community Hospital. You do have to meet 3 of these criteria in order to receive this treatment. Positive COVID test, mild to moderate COVID-19 symptoms for 10 days or less, and be at high risk for severe COVID-19 illness, be pregnant, or have underlying health conditions. You also have to be over the age of 12 to receive this treatment. Treatment is free. Physician or self-referral is accepted, and you should call your medical provider to see if you're eligible. All right, thanks, Tony. Next slide. All right, so let's discuss the antiviral medication. We have 2 pills right now that have been authorized by the FDA. One is from Merck, it's called Molnupiravir, and the other one is from Pfizer, and it's called Paxlovid. Both are for use in patients who have a positive COVID diagnosis and who are at risk for progression to severe COVID-19 disease, including hospitalization or death. Both are by prescription only and should be initiated as soon as possible after diagnosis for COVID-19 and within 5 days of symptom onset. Note that both of these treatments are effective against Omicron. The 2 viral antipills mentioned are in very short supply and should not be a substitute for getting vaccinated. Next slide, please. So let's move on to some vaccination and testing information. All right, so this bubble graph is showing the difference in cases for many vaccine preventable diseases in the early 1900s compared with data from 2010. 2010 is on the right-hand side. As you can see, due to vaccination, the number of vaccine preventable diseases has decreased a lot over time. While disease rates are low, these diseases have not disappeared completely, and that is why it's still so important to get your vaccines. Next slide, please. All right, so COVID-19 vaccines are still the best tool that we have to stop the pandemic and, of course, to protect people against severe illness, hospitalization, and death. Even if you have gotten sick with COVID-19 in the past, vaccination provides you further protection. None of the 3 COVID-19 vaccines can give you COVID as they do not contain the live virus. COVID-19 vaccines will not cause you to test positive on a viral test. All right, there are currently 3 types of COVID-19 vaccines available. The Pfizer vaccine is fully approved by the FDA for people over the age of 18 and is authorized for use for those in 5 to 17. The Moderna vaccine and the Johnson & Johnson vaccines are both authorized for use in people who are 18 years or older. All 3 are safe and highly effective against serious illness, hospitalization, and death. Both the Pfizer and Moderna vaccines have a 2-dose primary series, and the J&J vaccine has a 1-dose primary series. Next slide, please. All right, so boosters is a big topic right now. They are so important, and if you are eligible to receive one, we're really encouraging you to get one as soon as possible. If you receive the Pfizer vaccine for your primary series, if you received it more than 5 months ago and are over the age of 12, you're recommended to get a booster. If you received the Moderna vaccine for your primary series more than 5 months ago and you're over the age of 18, you're recommended to get a booster. Finally, if you received the J&J vaccine for your primary series more than 2 months ago and are over the age of 18, you are recommended to get an mRNA booster. So I'll just say that again. If you did receive a J&J vaccine for your primary series, it is recommended that you receive either a Pfizer or a Moderna booster. Next slide, please. All right, so we have multiple fixed and mobile vaccination sites around the county. For more information on vaccination or testing sites, please visit sjready.org. And these flyers, these green flyers on this slide, we always post to our social media. So if you're ever wondering what might be in your area, these are our mobile vaccination clinics. Next slide, please. All right, there are recently expanded hours on our fixed testing sites around the county, as well as some new testing sites that have opened up to accommodate the increase in demand for testing. We are encouraging residents not to go to the emergency departments for testing unless you're experiencing a true medical emergency. Our hospitals and ERs are very crowded. As of January 15th, you may submit a reimbursement request for the purchase of up to 8 tests a month to your insurance. You cannot submit requests for tests purchased before January 15th. Additionally, the federal government has opened their site to request for rapid tests per household. I believe Tony is going to put the link for those in the chat. You do have to provide your name as well as a shipping address for those. All right, next slide, please. All right, so there are two types of tests commonly used to see if someone is COVID-19 positive. Rapid antigen tests can give you fast results, but are less reliable early on due to decreased sensitivity. They can produce false negatives if used early on. If you use a rapid antigen test early on during exposure or suspected positivity, it's recommended that you do follow that up with a PCR test. PCR tests are the gold standard for testing as they have more sensitivity and produce a more accurate result. These tests do take a little bit longer to get results as they are processed in a lab. Next slide, please. So when should you get tested? You should always get tested if you are experiencing COVID symptoms, even if you are vaccinated. If you are exposed to a confirmed case of COVID, you should try to be tested as soon as possible. If you are involved in a high-risk activity, such as traveling or attending a mass gathering, you should be tested. If you are asked or referred to get tested by a medical provider or from your local or state health department, please do get tested as soon as possible. Next slide, please. So we're coming to an end here. I just want to say that, again, our sjready.org is the one-stop shop for finding all of our testing and vaccination clinics in our county, as well as any COVID updates from the state or from San Joaquin County. You can also visit our website at sjcphs.org for any additional public health questions or needs, and you can call 211 for assistance. We also post updates and information on testing and vaccination across all of our social media platforms. So thank you so much for your time today. At this point, I think we're going to open it up for some questions.
Thank you, Alex. Oh, sorry. I just wanted to kind of add a little bit what Alex presented, some notes I took. In terms of data, public health does produce the data 3 times a week, so you can always go to our website and get the latest data. I know that various media do share their information that they may have collected from other places, but in order to get the most accurate data with regard to where we are with COVID, I strongly recommend visiting our webpage to get the most current data. It is the one that matches very closely with the state. And again, I wanted to reemphasize what Alex mentioned. Boosters are definitely very important at this stage. We just saw some recent studies that are showing that having the booster has been probably the most effective preventive stuff right now with regard to the Omicron variant. So that's a really important stress for that. And then also in terms of why, day 5 is really critical is because we want, if you've been exposed, you may not be able to you may not detect the virus right away. And so you need to give a little bit of gap in terms of determining whether you have it or not. And so we wanted to make sure that if you've been exposed, so you're quarantining for 5 days and you should get tested on day 5. If you have been diagnosed and you have COVID, it's 5 days later. We're expecting that you may still have the virus. However, you may be at a point where you're not contagious. So that's why day 5 is kind of like a critical point at that point. So, but yeah.
Thank you for this presentation and this information and for this space. I do want to ask a question. So what we do with our grant is we do a lot of research via assessments, interviews, focus group surveys, things of that nature. And what we've learned from the data is that one reason that people are wary towards the vaccine or the boosters and whatnot is because of the ever conflicting changing in messaging, right? And so my question is, for the experts, is that what is the difference between the beginning 14 days and now, 10 days, as you said, that 5 days is that very important part? And how can we properly address that? What does the data show about 5, 10 days versus 14 days in the beginning?
Yeah, so of course, 14 days was sort of a really buffer that was first determined. We are seeing very early when COVID came out, and so we didn't know how long the virus would incubate. And as since then, for these last almost 2 years now, we have been able to do a lot of research, knowing how when you're exposed to when you're most infectious. So that's why we've been able to see a reduction in those days. So 14 days was initially, just to be safe, but then now, we are down to about 5 to 10 days. So what we know so far is that from the moment that you're exposed, it does take a few days, of course, for the virus to incubate, and it's usually 2 days before your symptoms appear that you're infectious, as well as a few days after your symptoms appear. So there's that kind of window. We were talking about a lot in the past about asymptomatic individuals. So you may have somebody who's going around who has been exposed. A couple of days later, they're still not showing any symptoms, but they may be contagious at that point. And so once they start showing symptoms, they're still contagious. But then what we're seeing is about day 5, if they start showing their symptoms, and if their fever isn't continuous, about day 5, they may still have the virus in them, but they're not at a point where they can spread it to others. So that's why we do recommend, getting the test on day 5 in order to be released. Otherwise, just to be safe, you can stay home at day 10. And of course, we don't want to have people out for 14 days, for any reason, because people have to work, people have to go to school, and so we over time we had to narrow it down to maximize really, when people can be safely released, so that they're not spreading. So that's the main reason, I think, to kind of explain, what's changed. And really, these last 2 years has been a learning moment. At first we said we didn't need to use masks, and we realized we do need them. And, we learned what types of masks are important and most effective. So and that's what science is. Science is, making the discovery, but then learning more as we go along, and making changes and making adjustments as we learn more information.
So I was going to kind of lift up an example and then just ask, maybe to confirm that or not. So I know individuals. For myself, I've had both vaccines, Pfizer, and then I had the booster. So I know individuals as well that have had both vaccines, and then they did get COVID. But my example is I also know individuals that had COVID very, very bad prior to the vaccine coming out, got the vaccines and the boosters. They were exposed to COVID a second time around. And some of the testimonials that I'm receiving is that they have something to compare it to. And so they're saying that the second go around when they had it held that it was very, very minute in comparison to the first time around. And so is that difference that we're seeing, when people are vaccinated and have the booster, they can still be exposed, but it might not be as threatening as it is if you haven't had the booster vaccine?
Yeah. So, as I mentioned, we're learning quite a bit, and we're very lucky that we have vaccines available. So that first 9 months that we didn't have a vaccine, so all those individuals who've been exposed for the first time, we did see a lot of worse outcomes with regard to being very ill, being hospitalized, a lot of use of the ventilation systems, as well as deaths. And so, and then we also noticed that a lot of people who had chronic conditions like diabetes, heart disease, lung disease, all of these issues, contributed how severe their cases have been. Since we've gotten the vaccine, obviously, what the vaccine doesn't do is it doesn't 100% protect against the disease, and that's one thing we want to make clear. This doesn't. What it's doing is basically boosting your immune system so that it can be as effective as it can when you do get exposed. So, we'd like to think that it's like a cure or something that can prevent, but unfortunately, that's why we talk about 94% effectiveness, 70% effectiveness. Even the flu virus, the flu virus that happens every year, annual flu season, we also get flu shots for that. Surprisingly, the effectiveness of those vaccines float around 50%, but yet, we take it in order to prevent some of the more severe cases. Again, it doesn't prevent 100%, but what little, what protection that we can get, is important. What's great about the COVID vaccine so far is that it's more than 50%, as I mentioned, close to over 90% in some cases, as well as 80 to 90% in terms of protection, especially with the more severe situations, the severe illness, being hospitalized, and also, of course, death. So what we're finding is, of course, if you get the full course, being fully vaccinated, you should be protected. Or if you've gotten COVID the first time, you have at least some level of immunity because your body's built up the immunity against COVID at that point because of the exposure. However, you can get exposed for the second time, and so your body is prepared better. So that's why you may, with the vaccine as well as the booster, or having been recently exposed, or having had recently COVID, the effect may not be as bad. And so that's why right now what we are seeing with Omicron, while we are seeing a lot more people getting sick with Omicron, even though they've been, fully vaccinated and even boosted, unfortunately, they're not at the level where they have to go to the hospital. I mean, I'm not going to say that there's nobody that hasn't, there are still some individuals who are still at higher risk for those situations. But what's important is that the large number of cases, we're not seeing them appear at the hospital as like we did previously at lower rates. So it's clear that, having being vaccinated, getting boosted, and is effective in reducing your risk for severe illness. And that's our goal, is to try to make sure that, we're not sending everybody to the hospital, and that you can recover at home at this stage.
That's good.
Go ahead, Chris. I have one more question, but go ahead.
No, go ahead. I'll ask after that. You go ahead.
My question has to do with the special testing kits that we have access to. So I don't want to shift all the way to that, Chris. If you had another question that was related to where we are.
Yeah, kind of, because I want to touch on what he stated as far as Omicron. We see a lot more people getting sick with this, as you stated. And I think early in the presentation you said that if you're exposed but you're vaccinated, that they don't have to stay at home the first couple of days. And can you explain why is that? Because in the beginning we wanted to stay at home, now we don't. So can you help explain that to the audience too?
Okay, so I guess I want to make sure I'm clear in stating this. So if you have been exposed at this stage, meaning that you haven't tested positive, but you know that you, let's say, are living with a relative that has been, that it does have COVID, then let's see, it's still recommended that you do stay home for 5 days. Mainly because, again, because of your exposure, your close contact with that individual who is definitely positive, there's always the chance that you may have it, and then in those 5 days, your symptoms could appear. However, after those 5 days, and if we again recommend getting tested. So let's see, again, I think it's if you are fully vaccinated and boosted, then you don't need to quarantine. Is that correct? Let's see. Vaccinated. Yeah, it's the individuals who are unvaccinated or who are vaccinated but they didn't get the booster while they're eligible. We do recommend that they have to stay home. it's the individuals who are fully, fully vaccinated, fully boosted, who are not showing symptoms. They don't need to quarantine. Yes, they don't need to quarantine, but we still recommend that they test on day 5. Because there's always the chance, because at that stage, if they're not showing any symptoms, we're hoping that they're not spreading, but it's that test on day 5 will at least determine whether they, have the virus or not, and whether they're at risk for spreading. We see that a lot of cases with regard to individuals who may have a child or been exposed to a spouse or another family member. And then when they're at home taking care of them, they may get exposed during that time. And then, of course, on day 5, they have to get tested. And therefore, that starts their isolation. So that's the thing. I think we always use the term isolation and quarantine very interchangeably. But isolation is for the individual who definitely has COVID, whereas quarantine is because you're potentially exposed. We want to make sure you're separate. You're quarantined away, or at least controlled in terms of not preventing the spread of the disease to others. And so it's that slight exception where you're fully boosted, fully vaccinated, and you're not showing any symptoms, and you're only a close contact, that you don't have to be quarantined. However, we still recommend you get tested on day 5 to confirm that. Yeah.
So Daniel, I wanted to ask you, what do you recommend for those who are having trouble finding these rapid tests and having trouble getting appointments? Because we know these appointments have been pushed out for a couple weeks right now. What are your recommendations for that?
Yeah, right now, with really the biggest, concern, of course, for all of this was the winter, Christmas time, when people are gathering. And then, of course, kids going back to school, have people going back to work. They're being told they need to get tested as part of, returning. So there's a huge demand on all of our testing sites. The county has been working with all of our vendors and working with the state to expand testing times, locations as best we can. So that's why the SJ Ready website is a great place to find out where you can schedule, getting a test, so that you can determine whether, of course, if you're ill, to find out whether you definitely have COVID, or if you need to get cleared in terms of being able to return to work or school. One of the other big things at the national level is that the U.S. government is now making home test kits available. And so through the web address that's scrolling right now, you can order a kit of 4 tests per household right now through that website. And hopefully we'll be starting to see them next week or within the next 2 weeks. Obviously, this is a big rollout of providing rapid home test kits so that you can find out sooner. And I did want to at least take this time to kind of differentiate, or at least expand a little bit in the difference between a rapid test versus a PCR test. So with a rapid test that everybody is now looking for and trying to obtain, the rapid test, what it does is basically determining whether you have the disease at that time or not. And so it's not as effective it is effective when you have symptoms. That's why, when you go to a testing site, you're feeling ill and you want to see if you have COVID, you can take a rapid test at that point. It may show, positive, and clearly that means you have COVID at that time. And of course, you would have to start your isolation. However, sometimes those tests may show up that you're negative, even though clearly you've got these symptoms that may be COVID. So what we always recommend with that initial diagnosis is to follow up with a PCR test. So the PCR test, as Alex mentioned, does take a little bit longer because it's got to be processed through the lab. What that's doing is it'll take the sample within your system. If you have any amount of the virus that's detectable, what the PCR process does is it amplifies the virus to see whether you're at a level that you can spread. So therefore, usually if you have a negative or a positive PCR test, you can always confirm it with, rapid test, and you confirm it with a PCR test. That'll confirm, whether you have it or not at the beginning. We recommend the rapid test, however, for day 5, mainly because if you are ill, So you're staying at home for 5 days. So in day 5, when we recommend, once your symptoms have mostly cleared, we want you to get tested. It says that you can take either antigen or PCR test. The antigen is the rapid test. And so if you take the rapid test, that will determine whether you're still at a level to be spreading. And so usually that will clear you right away. Or if you're still spreading, then you don't want to take another 5 days at that point. However, with the PCR, because of how sensitive that test is, you could be not contagious at that point, but then still on day 5, still have detectable levels of COVID. And therefore, you could be unnecessarily stuck at home for another 5 days. And so that's why we really recommend getting the antigen rapid test on day 5, so that at least it'll clear you to be able to return to work or return to school. But again, in terms of for diagnosis, PCR is a better way to determine that. And we do, again, recommend the PCR test for diagnosis when you have symptoms, because it'll direct you in terms of your course of treatment. We talked about the monoclonal antibodies as well as the other antivirals that are available. If you know that you have COVID, those options will help you reduce your risk for getting the severe illness or hospitalization. However, if you have flu, you know what to do. You stay home and take care of yourself. And as long as you don't have any of the severe symptoms which do require you to go to the hospital, you can always take care of it at home, and you can return to work once you're feeling better. And that's what we need to know, is because we want to differentiate whether you have the flu, the cold, or COVID. And knowing that will help you direct yourself to the proper treatment.
Now, since you started talking about the flu, I want to know if you can give, our audience some idea of how to determine whether or not you should take a test if you are having flu-like symptoms.
Yeah, so right now we are recommending pretty much any flu-like symptoms to go ahead and get tested, because as I mentioned, you don't know whether you have the flu or whether you have COVID. And we've heard of some cases, where you could have both. Right now, I could say that, in terms of flu, when you have your COVID test through PCR, we are also usually checking for flu, but flu is present in the area, but it hasn't caused a lot of problems right now. But we still do know that flu is present. So of course, in terms of symptoms, they're very similar. One of the big indicators right now that I'm seeing that tells you may be concerned is that you may have COVID is the loss of taste and smell. I've heard quite a number of stories of people where they're feeling okay and eating something or drinking something and it tastes off. So, and they know that they've been exposed. So that may be a potential sign for COVID. The symptoms are very similar. Runny nose, fever, cough, being run down, fatigue. They're very similar symptoms. However, it's only through the test that you can determine whether you have flu or not, COVID or not. And again, that will determine, what the best course of action would be. So if you're at risk for any, more severe outcomes because maybe you have diabetes or a heart condition, knowing that you have COVID will at least open up the options to maybe go get the monoclonal antibody treatment, or if you're immune compromised, to be able to get maybe some of the antivirals if you qualify, and also you can get it through your physician prescribing it. But that's really why we recommend having any symptoms to go ahead and get tested. And especially, testing is important if you know that you've been to an event, especially parties, dinner parties where you're unmasked, or even large gatherings. Again, one of the biggest problems is that people feel great or don't feel anything, having come back from that. But it's that 2 or 3 day window before they actually show symptoms where they may be highly contagious at that point. So that's why we do recommend getting tested at least, a couple of days after the event. Again, we want to make sure that if you've been exposed, we don't want to give a false a false negative result, taking it 1 day after the event, because you're still incubating if you do actually get exposed. But like a couple of days after, that's why we say 3 to 5 days after travel, or 3 to 5 days after an event, get tested. And then, then kind of your status at that point.
So after the event, then let me make sure I'm clear. Just so after the event, is it better to, if you have the option of work remote, or making sure that you're wearing your mask, and then test within the 3 to 5 days? So just take the extra precautions, is what I'm hearing be
Correct.
said.
Yeah, we don't want to quarantine people just because they went on a travel or had attended a party. If
Okay.
you're not feeling any symptoms, and especially if you know that you're fully vaccinated and boosted as well, masking is really key. You don't want to spread
Okay.
it to anybody else during that time, and then wait till that 3 to 5 day window to get tested, and that's where again a rapid test would be helpful. And again, we still recommend getting a follow-up at that point with the PCR, because then you will know whether you are starting to develop it or not, or you test positive. And then that's where you can determine whether you're going to need to isolate or again just continue to wear a mask for up to 10 days or so.
Okay. Daniel or Alex, either one. So Faith in the Valley and public health advocates, we actually have access to PCR tests that can be used at home. However, the population and the base that we engage with is sometimes very hesitant. They only want the rapid test. And so we're going to make them available. So Faith in the Valley will be making PCR tests available along with rapid tests within the next couple of weeks to be able to get into the hands of members of congregations and to distribute into hard to reach communities. With that, we're going to encourage the use of the PCR test based on what we've just heard today. Um, how do I use that PCR test at home and then get it to a lab? How do I do that?
Yes, so I believe, Alex, do you have more information with regard to the PCR at home tests?
Sure. So all tests, rapids, PCRs, they will come with a user manual. And most of the companies that make those tests will also have a YouTube video showing someone doing the test. And that might be a little bit more helpful for
Mhm.
people to actually see it being done. I know with some of the PCR at home PCR tests that we had, it was very similar to the rapids, where you're doing your swabbing and then you're
Mhm.
going to go ahead and insert it into a tube,
Mhm.
seal that up, and then you're going to have to FedEx it off. And those are taking a few days to get back, just like any PCR would. It's going to go to a lab and get tested, and then you should get your results. It will have information inside of your test kit on how you're supposed to access those results, and usually it means registering yourself on the website. Um, as far as, I don't really know any other information. I don't know which specific PCR test you're using, but yeah, you know what? I just think with the lack of tests that we sort of have in our hands at this moment, if you have a test, use the test. You know,
Okay.
rapid
And
PCR.
it's the ones. So we would actually be picking some up from public health services as well.
Sure.
And the Alex, what you just laid out was exactly the instructions that I was giving as well. And so what I'm thinking, Chris and Mary, what we probably going to do is that Tony is going to be a test dummy, and I think that I'm going to go ahead and on our next live and our next COVID conversations that I'm going to do the at-home
Mhm.
PCR test live in front of everybody, put it in a thing, break it off, and then walk through the process of what it takes in order to get that thing from my house to the lab. Um,
Mhm.
and we kind of make light of it or what have you, but at the end of the day, it really is the inconvenience of having to, if they're not coming to swab me in my nose right at my door and drop it, in the box and take it to the lab for me, you know, so but we want to make this thing a little bit more accessible so that people feel like they have more control. COVID has just really robbed the community of feeling like they have any power and control of their overall well-being and safety. It's hard to fight an invisible virus that you can't see. And so the tools that we've been given is amazing, right? To have access to them, but we want to make sure that folks know, hey, we have these tools, the health services, you guys are providing these resources for us. And so we need to make sure the communities of color know how to use them and what to do with them when they get them.
Yeah, I would want to note, for the PCR tests, you do want to, limit them when you really need to know, whether you have COVID or not, for as the situations I mentioned, to determine whether you've been recently exposed. You can still use the rapid test at that point too. That's always, that one is supposed to be more, obviously that one you get a result more quickly. But you can do it over several periods of time. With the PCR, that one you have to send to a lab, and that will take time. And you don't want to. One, we don't want to overburden the lab, knowing that you're going to get like 3 or 4 tests in a row. That's where maybe the rapid test would work on a daily basis. But again, the PCR is good, as I mentioned. After a recent exposure, a known recent exposure, then you want to at least do the PCR test. 3 to 5 days. But you can still also do the rapid just to sort of double check that. But that's why we say that the PCR is sort of a backup to the rapid to confirm, because it is a more gold standard. But once you know that you're diagnosed, again, we don't recommend doing the PCR at day 5 after you've been sick, because again, it may still show that you're positive, but you're not really contagious at that point. And so that's why we would recommend more the rapid test at that point.
Okay.
After you've been sick. Yeah.
So I've been exposed, and then I wait 5 days, quarantine. If I'm exposed, I isolate. So if I've been exposed,
no, sorry. If you've been exposed, you don't have it yet, or that you've been exposed to somebody who has, then you are quarantining. Yeah.
Okay.
Isolating is for the people who actually have it, who have tested positive. Yeah. It takes some time, but it's, if you can think of it in terms of a individual who is definitely ill, you want to isolate them, whereas quarantine means to separate out. So
gotcha.
Is there anywhere where because it is, I see what you're saying too, the differences with quarantine, isolation, the days and stuff like that. So for our audience, is there anywhere where they can get this information? Is sjready.org where they can see this information at, or would you recommend?
Again, yes, I believe we have that information defined there, and if we don't, we will definitely put that out there. And another thing to mention is that we are also on all social media pages, so Facebook, Twitter, Instagram. We have been putting out messages almost like 5 or 6 times a day with different tidbits, which would include definitions. And so we highly recommend visiting those when you can. Scrolling back to some of the information that we provided more recently. We do have calendars that update test locations where the nurse van may be located as well. So those would be really great to share out for the latest update. But SJ Ready is, as Alex mentioned, is kind of our goal for a one-stop shop, so that you can find the latest testing information, and it will direct you to our public health webpage as well. So, and then of course, you can always reach out. There are ways to reach out to public health staff who can answer specific questions as well.
And so in wrapping this up, and other things as well is that when all else fails, you can dial 211. 211 works. And they have been working in partnership with public health services in order to just have access to information. They can route you to information and services. 211 works. When all else fails and you just don't know what to do, call them and ask them any question in the world, and they might be able to point you to it or not, but 211 works in this instance. So we have shared links to their public health services Facebook page, their Instagram page, sjready.org. We've dropped those links in the chat as well. We've also dropped links to where you can order your 4 kits through the Postal Service. So you have access to that. You can connect with Faith in the Valley and just go to our page, and you can message me, Tony McNeil. You can connect with public health advocates. And let me see here. I've got Chris on here. You can email Chris Cannon at Public Health Advocates in order to get connected to resources. There's no excuse for you to not be able to access information. None whatsoever. This is me. I'm talking to my folks now. No excuse whatsoever for you not to get access to information. Hit me up on Facebook if you need to. But the information and the resources are there. If you have any questions whatsoever, please do not hesitate to reach out to us. We will do our due diligence in order to make sure that you have access to it. And yeah, I want to thank you guys, public health services, San Joaquin County Health Services. I want to thank you guys for taking the time today to join us. And bring us this information. I mean, like Johnny on the spot. I reached out to them, y'all, over the weekend. And so, I mean, for real, Daniel, man, I'm just saying kudos and stars. You deserve a promotion, a raise, and all of that, along with your team and teaching and educating staff, because you guys have been amazing. I don't know what other counties have, but I'm telling you, you guys have been right there, ready.
Well, thank you, Tony. We really appreciate opportunities like this, and thank you for the invitation to be able to share this latest information that we have. And again, we're always open to come back and answer questions. Our goal is, of course, to answer people's questions, because we know that people are hesitant, have some doubts, and the more information, the more correct information, especially coming from our agency, is really key to making a final decision in terms of getting protected and protecting others around you.
All right, you guys. So make sure that you share this information. We'll recirculate it out. And I think that we'll probably reshare the video this evening as well for others to be able to tap in. Chris is saying, yeah, so we'll do that. But yeah, thank you guys again for tapping in. Thank you, Alex, for the presentation and sharing that information with us, and Mary and Chris for tapping into COVID conversations. We will see you guys again sometime later this month with another topic from our COVID conversation space. So you all have a wonderful evening and be safe. Peace.